How do we educate the medical community on AGS?
And this is a great question, and it's one that we struggle with a fair amount. I feel like those of us that take care of patients with AGS, we try to raise awareness and we talk about it a lot. But we know from studies that have been done that it can take up to 7 years to get a diagnosis of AGS. So there clearly is work that has to be done from an awareness standpoint, and reaching physicians and providers sometimes feels as though it has to be a one-on-one conversation, and that just talking about AGS in and of itself doesn't really do the job. So it is, I think, an ongoing conversation that we have to continue to have, um, trying to get into certain medical conventions or conferences where people are gathered, and we can educate thousands of providers within a 15-minute talk is really probably one of the better ways to do it in terms of efficiency. But equally, I think the just sort of word of mouth and conversation is a big part of this as well. And I think it's happening. We're certainly hearing more and more folks say, I've heard of that. I've never diagnosed someone with it, but at least I've heard of it. And that's a big step in the right direction. So we just have to continue to keep raising awareness and talking about AGS at every opportunity so that we can educate as many healthcare providers as possible. It really helps patient care just to be able to have providers that are aware of it and would even think about the initial presentation of someone in an urgent care or emergency department setting, in hopes that we can get a diagnosis for that person more quickly and that they never have to have another bad reaction.